So I'm here today to give you an update on what's going on in British Columbia and around the world with the new COVID-19. And I want to start off by giving some very positive news in that our first case here in British Columbia has fully recovered, and as of the weekend we had our second negative test, so he is considered cured and no longer required to be in isolation. I think that's very good news. Good news for us and good news for him. Our second, third, and fourth cases are now all asymptomatic, and we fully expect that their testing will come back negative in the next few days as well. So all very positive in terms of recovery. Case 5, who we identified in the Interior Health Region on Friday, continues to have symptoms but is stable condition and is doing well in isolation at home and is being monitored very closely by public health. I also wanted to talk a little bit about how we're managing things from a contact perspective. I know there's been lots of questions that have come to me over the last few days about how do we know that nobody else was in contact. There's rumors that people were here or there, and how can we be sure that people are doing what we ask them to do? And really, this is the work that we do in public health in our communities around things like this type of infectious disease. So we are finding all the close contacts, and how we do our investigation when we have a case is to go through all of the places that they've been, understand where they might have had dinner, if they were in a private car, did they take public transport, were they on an airplane, all of the contacts from even before they started showing symptoms, so that we can do what we call a risk assessment and see if there's anybody that might have had close contact in a situation that might have allowed transmission of this virus. So for example, case 5, we did know that she had some symptoms on the flight on her way here, and we were able to track down those who sat around her on the flight manifest in partnership with our federal colleagues, and those people have been connected with so that we can reassure them, for one thing, because she had very minimal symptoms and was wearing a mask, so that's always helpful, but also to monitor them over time, make sure they know what to do should they develop any symptoms, and have direct contact with them over the period of the incubation period. So we also look at things like, did people go out and get groceries? Did they have contact with their neighbors? And all of those things we are confident that we have in place for all of the cases that we've had here in BC. And we've identified a very small number of close contacts who may have had risk, and all of them are being followed on a daily basis by public health. So far, none of the close contacts have had any symptoms of disease. So if we are quite confident that we know anybody who may be at risk, and that can help dispel rumors that seem to happen in places where people are concerned that somebody might have been. I also want to say that we've been following very closely the number of cruise ships and some of the incidents that have been happening, particularly in Japan. And as we know, a number of Canadians are both affected by coronavirus and are in hospital in Japan, and a number of people who are not infected will be looking at coming home, and the Government of Canada has a flight that will be coming back, and we understand it will be going directly to Trenton and then on to Cornwall, and people will be asked to stay a further 14 days in quarantine there. At least that's the plan at the moment. We've also been following what's been happening on the cruise ship, the Westerdam, because there have been Canadians on that cruise ship as well, and it was the one that docked in Cambodia, and after docking in Cambodia, a woman was identified with the coronavirus as she flew on to Malaysia. So there were a number of Canadians who are still on board the ship and who are being assessed and tested on the ground there. But we also know there are some Canadians who returned before that person was identified. And there have been about 20 of people who were passengers on the Westerdam who've returned to British Columbia. All of them were identified at the border, and we have connected with them. Public health is following them on a daily basis. We've been asking them to, we've been putting them in self-isolation and quarantine at home until we have a better understanding about the situation. So it may not be that we require them to be self-isolated for 14 days if nobody else shows up as positive and we have a better understanding. But right now, there is still concerns because cruise ships can be such an area for transmission of this virus that we are an abundance of caution asking people to stay home, and we're supporting them and monitoring them daily right now. Finally, I think it bears saying that we know that the Canadians who have been in quarantine in Trenton from the repatriation flights will be finishing that 14-day period in the next few days, and many of them will be returning here to British Columbia. And so I think this has been a very stressful time for all of those people, both coming from Wuhan, but also spending 14 days in isolation and not knowing what was going on in Trenton. We do know that nobody has tested positive for the virus in Trenton, and that when these people finish the quarantine period, they will be free and clear, no longer needing to isolate. And as you can imagine, I think this is our opportunity to welcome them back into our communities here in British Columbia. So I think that's something we can look forward to in the next few days. Finally, we continue to have a very low threshold for assessing and testing people here in BC. We're continuing to have people from across the province every day being tested, over 500 people now, and other than the 5 positive people we've told you about, nobody else has tested positive. I will say, however, that many people have tested positive for influenza, and that is not surprising to us. This is our influenza season, both here and in China. So people who have traveled, who develop a fever and symptoms, are much more likely to have influenza, and all of those things that we do every day to protect ourselves from influenza are also important things to protect ourselves from COVID-19. So again, cleaning our hands regularly, not touching our face and eyes, covering our mouth when we cough, and if we're sick, to stay home and stay away from others. So I am encouraging everybody in BC to be vigilant about that now and to continue these measures. We're watching, of course, very carefully what's happening in China and in a number of other countries around the world, and we are still in that critical period where we don't know yet whether all of those measures that are being taken in China in particular are going to be able to contain this virus, or whether we are going to start seeing more widespread transmission in communities around the world and potentially here in BC. So we are not letting up on our vigilance around this virus, and certainly we have another several weeks before we will have a better understanding of how this is going to evolve and particularly evolve in the next in this season, and whether we'll need to pay attention to this virus for many years to come. I'll leave it at that for today, and I'm happy to take questions.
I'm just wondering if there are any numbers, confirmed numbers from either the cruise ship or the number of people at CFB Trenton that are confirmed to be BC residents. Like, how many people are you expecting to come back from quarantine?
It's a fluid number. I can say that approximately a third of the people in Trenton are planning to come back to British Columbia, but it is moving day by day as people are trying to make arrangements and find out where they're going to end up.
And I just want to clarify too, so the plane coming back from Japan, it will not stop at YVR to refuel, at least at this point.
That's right.
Thank you.
So initially they were thinking they would have to, but the flight is that much shorter that they can fly directly into Trenton.
Hi, Camille Baines with the Canadian Press. You said earlier that these people will be making their way home from Trenton and they should be welcomed. What do you mean by that?
Well, just that it's been a very trying time for many of them. They both in Wuhan before they were repatriated, and then having to spend time away from their family and friends. And we now know they do not have this virus. So I think it's our opportunity to say, welcome back.
I'm just asking because earlier you had mentioned at another news conference that there were rumors and there were concerns about how people were being treated.
Yeah, and I continue to hear that people are concerned that people who have traveled might be a source of infection that they don't know about, and I can reassure people that we've been monitoring people carefully, and certainly the people in Trenton have been monitored every day. There have been a number of people who have had some respiratory symptoms and have been tested, and nobody in Trenton in any of the repatriation planes has tested positive for the coronavirus. So they are out of a very dangerous and stressful situation in China and through the quarantine period and are healthy and well.
Hi, Dr. Catherine Urquhart with Global News. Last time I was here, we talked about the fact that it's still a 14-day incubation period.
That's true.
Do you still believe that's the case? Because there have been reports that question that still.
Yeah, and I think we've in the scientific world have been looking at that very carefully. The challenge that we have with a couple of the reports is they're based on, we look at the cruise ship, for example, it's based on when people test positive, not when people's symptoms started. So it's hard to sometimes understand that. It's very clear that people can transmit this when they have very mild illness or may not even realize that they're sick. And certainly that's something that we look at when we're doing what we call contact follow-up. We look at not just when I started being sick, but in the days before that to see if there was close contacts that might be at risk. So that is something we try and take into account. The vast majority of transmission from what we can see is definitely when people have symptoms, even if they are mild, but there have been sporadic cases where it appears that people may have contracted it from somebody who either didn't recognize they had symptoms or was didn't have any symptoms at all. And there was some interesting reports that came out just in the last few days. One that showed an incubation period of maybe 24 days, but that one is an outlier, hard to say. The other was a report on somebody who didn't have symptoms where they were able to isolate live virus. So that tells you that potentially that virus could transmit to others, but there was no known transmission from that individual. So I think the consensus is still that we are learning, but that the vast majority of transmission happens when people have symptoms and with people who are in close contact with them.
Frank G. with Omni News. There has been report in China saying that there are people who have been tested twice negative and released from hospital asymptomatic, but has the virus again occurred in them and developed symptoms again. So is that a concerning fact that health officers here are aware of? And whether that is something will change how we deal with the situation here?
Yeah, it's certainly something we're aware of. It's very, and the concern is that maybe somebody who's infected doesn't have long-lasting immunity and they can be reinfected. So it's not at this point changing what we're doing here, although of course we keep continuing to monitor. It would be a concern if people were re-exposed, but we still have very little transmission of this virus here, and the risk is still very low for that transmission, so it's not something that we're concerned about here. We certainly are watching what's happening in China for sure, and whether it was somebody who was re-exposed or reactivated, it's hard to say.
Sabrina from NTD TV. So Chinese health officials just updated last week that people can contract coronavirus by aerosol transmission. Could you please clarify what aerosol transmission is and how is it different from airborne transmission? Thank you. Did you mean aerosol? Yeah, aerosol.
Okay. Yeah, aerosol and airborne are very similar in terms of what types of transmission, and generally what we talk about when we think about airborne or aerosol transmission are very tiny droplets that can last in the air for periods of time. So when we talk about droplet transmission, which is the most common way this virus is transmitted, it's larger droplets, and the virus needs that moisture to survive, and they tend to fall out of the air quite quickly and can be contained with the sick person wearing a mask, for example. When we do things to people, particularly in a healthcare setting, like sometimes intubation or giving them therapy through a mask that nebulizes the air, or even sometimes doing what we call a nasopharyngeal aspirate, so putting water in the back of the throat and trying to get samples that way, that can cause smaller droplets to spread in the air. And that is certainly a way that we're concerned about it being transmitted, particularly when you have a lot of people in a healthcare setting who are very sick. And that's what they were reporting on in China. And that's where we are very careful about the use of personal protective equipment and the types of rooms that we do those procedures on in healthcare settings here in BC. The vast majority of transmission of this virus appears to be droplets and from face-to-face close contact. So that's what we're focused on, certainly in the community. It does not appear so far that there's any evidence that droplets can last in the air over periods of time, for example, like measles. We know people who are infected with measles, when they cough, the tiny droplets in the air can last for several hours, and somebody who comes into the room even an hour later who may not be immune to measles can then inhale those droplets and become sick. We have not seen any evidence of that with COVID-19.
Hi, hello, Helen, Radio Canada. Just to be sure, the fifth case, is it confirmed or not yet?
Yes, that's a very good point. Yes, it has been confirmed. It was confirmed on the weekend by NML. Yes, the testing that we're doing here in BC has been validated now, and so we're not that surprised. We expect that it'll be confirmed, but that did happen on the weekend. Thank you.
Okay, thank you. And the other question is, we saw, for example, in Japan that Tokyo Marathon has been cancelled because of the coronavirus. Do you think we should cancel also event here in BC, or this is not as a threat as in Japan, for example?
No, right now we are not seeing transmission in the community here, and I don't feel we need to be canceling events at all in the community. Again, with the caveat that if you're not feeling well, don't go. Stay home and protect yourself and your family and others in your community.
Why is it that some people die from this virus and some people just get over it like a cold?
Yeah, so that is a very good question. There was a very detailed report that just came out of from the China CDC just on the weekend. So yesterday I was reading it in some detail, and it is really apparent now that from the first 72,000 cases that they have reported on, that it is older people whose immune systems aren't as able to fight off viruses, and people who have underlying illnesses, particularly diabetes and heart disease and lung conditions. So we see that very few young people, there were very few cases in people under the age of 19, less than 1,000 out of the 72,000, and there were no serious illnesses and no deaths in young people. And then as you got older, your risk of having severe illness went up, and it was people over the age of 80 who had a very high case fatality rate. So of the people who were infected, 14% of people over the age of 80 died from the disease. So we're learning more and more about that, and this was the first report that really looked at that by age group and by underlying conditions. And so it really, similar to other coronaviruses and certainly similar to influenza in that older people are more likely to have severe illness, but I think also some good news in that young people are not as severely affected. The other challenge, of course, is that the majority of people were between the ages of 30 and 59, and they mostly had milder illness. About 80% of people had quite mild illness, and that meant that the virus could be transmitted quite easily from people with mild illness. So that's also something we're learning.
Hi, Gautam from Omni Television. So the first person you said is already out of the woods, you know.
Yes.
So does it mean, does there going to be any more follow-ups for him? And, you know, it's like, or he's out of the woods completely?
No, and hopefully he'll remain healthy and go about his business, yeah.
CTV again. A question from my colleague. The couple of the doctors that died in China were, in their 30s and 40s. So just wondering if you can elaborate more on the younger people that are dying of this. Do they have underlying illnesses? Can you get into any more about that data?
I only know what's been in the reports, obviously, and the information that we have through the WHO team on the ground. So I can't say specifically for those two tragic cases. It is a challenge in that there has been such, and both of them were in Wuhan, the area where so many people have been affected, and it's been such a challenging time for healthcare workers there. We've been watching very carefully, particularly healthcare workers, because we want to understand the risk in healthcare settings, and there's been over 1,000 healthcare workers who were infected, all of them in Wuhan and Hubei province. And if we can imagine the conditions that they're working under, where they've had many, many very sick people in very crowded hospital facilities, and they've built these two new facilities where people have been working very long shifts. The challenge in maintaining your personal protective equipment and being able to effectively protect yourself it is really immense, and I think it's reflected in the deaths and the infections we've seen. I'm reassured, though, that we're not seeing the explosive outbreaks in healthcare settings, even in Hubei province, that we saw with SARS, for example, or with MERS in places like Saudi Arabia and South Korea, where we've had explosive outbreaks that have affected healthcare workers particularly, as well as patients, often due to unrecognized patients. So we're not seeing that with this, which may also be a reflection of improved infection control practices, and that the spillover into healthcare workers is really because of challenges in maintaining those practices.
James Fong, Singtao Daily. Two questions. The first one is, as you mentioned, the first case has been fully recovered. So, did he bring any help to the recovery of the other cases? And the second one is the Chinese restaurant has been greatly impacted in today's situation. So, do you have any advice to the restaurant or the customers?
Sure. I'm not entirely sure what you mean by did the first person help the other. They're not related, and so they don't. The first case had a small number of close contacts that were being followed separately, so nothing that...
Because we learned from the report that people they have drugs and they may have some help to
do you mean if somebody has antibodies, that can be used in treatment for others? Yes. So there is some experimental therapies going on in China, but certainly not here. We've not, and there's not been a test yet to develop or to detect those antibodies in an effective way yet. So no, that we have not been able to do that here. I know there's quite a bit of research still going on in China around different therapies, including using antibodies from people who have recovered. In terms of Chinese restaurants, I talked a little bit about what we do in public health, about following up all the contacts of people and tracing where they've been and anywhere that there has been a risk. And we have connected with those people. And there is no situation in British Columbia where any Chinese restaurant or any other restaurant has been a source of risk for this virus at all. So I can reassure people that we should not have any concerns about Chinatown, about any of the restaurants here in British Columbia, particularly here in the Lower Mainland, or any other restaurant in this province.
So now we'll go to the phone. Can you please identify yourself and the media outlet, please?
This question is from Mary Brooke. Mary Brooke, I'm putting you into the queue.
Thank you. You
Hi,
can.
Mary Brooke with West Shore Voice News. The Diamond Princess cruise ship has turned out to be an incubator, as we've seen. And I'm just wondering if there are more clues now as to how the virus is transmitted. Could it have been when the food trays were delivered to cabins, etc.?
Yeah, I think we're all watching that very, very carefully, and it was an incredibly challenging situation. There is a team on the ground who is looking at the investigation into that cruise ship. So the concerns that we have are, when did people start becoming ill versus when were they tested? And we're now realizing as well that there may have been unrecognized cases in crew members who were sleeping in larger multi-bunk dorms that may have contributed to some of the transmission through the ship. So the answer is we don't know yet, that the investigation is still ongoing, but it certainly will affect any other situation like this where we've seen that it was not an effective way of quarantining people, and we need to do better.
Thank you. And the second question, please. Second person in line.
Yep.
Thank you.
The next question is from Leanne Young from CBC. Please go ahead, Leanne.
Hi, Dr. Henry. So this is just kind of a follow-up to, I think somebody else had a similar question, just about advice for people who've been targeted by these coronavirus rumors. So you said that these are cases that you guys have looked into. I just want to confirm that they are, some of these rumors, that you guys are indeed looking into them, because some of the communication we received out of your office is saying that, no, these are not rumors that we would even bother investigating.
Yeah, so if there's a specific person who is connecting with us, who has concerns, we certainly are investigating that. Most of the time, there's rumors about so-and-so was in this restaurant or that restaurant, and we can just blanket say that our investigation has not included any restaurants, so we don't need to worry about that. So it depends a little bit about what the rumor is, but for the most part, the rumors are not ones that we would consider legitimate at all.
Are there no more questions on the phone? Any other questions on the floor? One last question.
There are no more questions on the queue.
Thank you.
Doctor, just want to know, for the first recovered case, did you provide any treatment or just by him self-isolation to recover?
There is no specific treatment for this virus, and all of the cases that we've had here in BC and in Canada have been relatively mild. So it's a matter of rest and hydration and good nutrition and letting your body fight off the virus.
So, one last question, over there, please.
This is Sabrina from NTD. So for the cases that are for people who are diagnosed and self-isolating at home, are there any family members with them?
In a number of our cases, there have been family members or people living in the same household.
Mm-hmm.
So we have provisions that we work with them to ensure that they stay separate from each other and aren't able to transmit within a household, and we monitor everybody within the household. So yes, there are things like wearing a mask if you happen to be in the same room, trying to stay and sleep in a separate room, not sharing utensils, ensuring that things are cleaned regularly, things like that that are effective at preventing people from transmitting within a household.
Okay, so one more following up questions. WHO just confirmed that around 92 cases, like people-to-people transmission.
Mm-hmm.
Also in China, there are households, like the whole family, who are live in one household, isolated, or they contracted they all contracted the virus.
Mm-hmm.
So would you think that self-isolation at home is effective?
Yeah, so here it has been, in that we are monitoring all of the people who are in the home, and none of them have developed symptoms. Many of the transmissions happened before somebody is recognized as having the disease, and some of them the reports have shown that there can be people who don't have any symptoms at all who have contracted it from family members. We do know that there is transmission in households in close contact. But the measures that we have are and we do assess the home to make sure that we can do it effectively. So if it was a situation where people were not able to effectively isolate within a home, then we have the option of having the sick person be isolated in hospital to protect the others. But in all the cases so far here in BC, we've been able to do it effectively in the home, and we've been monitoring all the contacts, and none of them have shown symptoms. And I think that's a really important thing. We still have very few cases here in BC and in Canada. We're still very much monitoring this carefully, and the risk of transmission here is very, very low.